You're a surgeon's apprentice in Guy's Hospital, London, 1847. The screaming stops before you enter the operating theatre, but the smell hits you first. Rotting flesh, mixed with carbolic acid and something sweet that makes your stomach turn. It's not the disease you smell, it's the medicine itself. Your master surgeon is wiping blood from his hands onto his coat, the same coat he's worn for 3 years without washing. The prouder the surgeon, the bloodier the coat. The patient on the table isn't moving anymore. That's usually how operations end here. What you're about to discover was hidden from medical history for over a century, and you're going to understand why you would have made the same choices that killed more patients than cholera, consumption, and typhus combined. You arrived at Guy's Hospital 6 months ago, the son of a blacksmith who saved for 3 years to buy you this apprenticeship. Your hands shake when you hold the bone saw, not from fear but from the mercury treatments Pemberton prescribes for everything. The surgical ward smells like rotting meat left in a tannery. Gangrene has a specific scent, sweet corruption that coats your throat and makes your teeth ache. You've learned to breathe through your mouth, but then you taste it instead. Your first patient was Thomas Miller, a dock worker who crushed his hand. Simple enough. Amputate the mangled fingers, cauterize with hot iron, bind with cotton soaked in turpentine. Standard procedure. Thomas died 3 days later. The fever took him, but not before his arms swelled to twice its normal size and turned the colour of spoiled liver. Black lines ran up to his shoulder like ink spreading through wet paper. My asthma, Pemberton explained, wiping his hands on his coat. Bad air. Nothing to be done once it takes hold. But you counted 17 patients that month. 15 died after surgery. The 2 survivors never needed cutting, just bandaging and rest. Your arithmetic is better than your medical knowledge, and the numbers don't make sense. Every morning you sharpen instruments on the same whetstone used for kitchen knives. The bone saw, amputation knife, bullet extractors, all cleaned with the same rag that wipes the operating table. The rag is washed once a week in cold water if someone remembers. The operating theatre is in the basement, lit by oil lamps that throw dancing shadows. No windows. Pemberton says sunlight weakens the blood. The wooden table is stained so deeply with bodily fluids that no amount of scrubbing reveals the original grain. You hold patients down while Dr. Pemberton cuts. They scream until they pass out from pain, then they're silent until they die. The lucky ones die on the table. The unlucky ones take days. Everything changes when you meet Dr. Ignaz Semmelweis. He arrives from Vienna carrying a leather case filled with bottles of chlorine solution. Dr. Pemberton introduces him as the Hungarian with peculiar ideas about cleanliness. Dr. Semmelweis asks to observe your procedures. After watching Dr. Pemberton operate on 3 patients in one afternoon, using the same knife wiped clean on his coat between cuts, he requests a private conversation. Your mortality rate, he says quietly. What is it? 15 and 17 this month, you answer honestly. Dr. Semmelweis closes his eyes. In Vienna, in my ward, we lose 2 in 17. That's impossible. Surgery is dangerous. Everyone knows this. Watch, he says. Dr. Semmelweis sets up his own surgical station in an unused room. But first he does something you've never seen before. He washes his hands, not a quick rinse, but methodical scrubbing with soap and hot water for several minutes. Then he dips his hands in chlorine solution until they smell like a chemical fire. He makes you do the same. The chlorine burns your skin and leaves your hands raw and red. The instruments, he says, into the chlorine solution they go, each one scrubbed and soaked until they shine like new silver. Why, you ask? Because something invisible is killing your patients, he says. Something that passes from corpse to patient, from patient to patient, from surgeon to patient. We cannot see it, but we can kill it. The first patient is Margaret Willis, a seamstress with an infected leg wound. In Dr. Pemberton's theatre, the leg would be amputated immediately. Dr. Semmelweis cleans the wound, removes infected tissue with sterilized instruments, and bandages it with cotton soaked in chlorine solution. Margaret Willis walks out of the hospital 3 weeks later, but you're not supposed to be working with Dr. Semmelweis. Dr. Pemberton finds out when he sees you washing your hands with soap. Waste of time and money, he says. Soap costs money, chlorine costs money. And for what? Patients die anyway. It's God's will. you're faced with a choice. Continue with accepted methods that kill most patients, or secretly assist Dr. Semmelweis, whose methods violate everything you've been taught. You choose to Semmelweis, because you've done the arithmetic. Working with Dr. Semmelweis means living a double life. During official rounds, you assist Dr. Pemberton with traditional procedures. You hand him instruments straight from the communal tray, wipe blood with dirty rags, and watch patients develop fever, swelling, black lines spreading from surgical sites. But in the evenings, you slip into Dr. Semmelweis's makeshift surgical ward. Here everything smells sharp and clean, like a thunderstorm. Dr. Semmelweis has covered the walls with sheets soaked in chlorine solution. The invisible enemy, he explains as you scrub your hands for the third time, travels on our skin, our clothes, our instruments. It jumps from corpse to living patient like fleas jumping between dogs. He shows you his data, careful records of every patient, every procedure, every outcome. In traditional wards, mortality rates hover between 80 to 90%. In his chlorinated ward, mortality drops to 10 to 15%. But why don't the other doctors believe you, you ask? Dr. Semmelweis laughs bitterly. 'Cause I'm suggesting that they are the killers, that their hands, their instruments, their methods are murdering their patients. Which physician wants to believe he's been committing murder? You learn his systematic rules. Rule 1. Wash hands with soap for exactly 3 minutes before and after every patient. Rule 2. Soak hands in chlorine solution for 1 minute after washing. Rule 3. Sterilize all instruments in chlorine solution for a minimum 5 minutes. Rule 4. Change surgical coats daily. Rule 5. Clean all surfaces with chlorine solution before and after surgery. The rules seem simple, but following them requires constant vigilance. You wash your hands dozens of times per day until the skin cracks and bleeds. The chlorine burns the cuts, making your hands feel perpetually on fire. But the patients live. Mary Thompson, factory worker, crushed leg. Traditionally, amputation and likely death, with sterilization, wound cleaning and healing within 4 weeks. James Crawford, soldier, bullet wound. Traditionally, dig around with dirty instruments until infection kills him. With sterilization, clean removal and recovery. You're keeping secret records, comparing outcomes. Dr. Semmelweis's patients live at rates that seem miraculous, but working in both systems creates terrible knowledge. You know that every patient you assist Dr. Pemberton with is likely to die from preventable infection, yet you continue because refusing would mean losing your apprenticeship. You become complicit in systematic killing while simultaneously learning how to prevent it. The mundane truth about hospital medicine in 1847 is worse than any horror story. Surgeons don't wash their hands because soap costs money and time costs money. A surgeon who can amputate a leg in 4 minutes charges more than one who takes 8 minutes. Adding hand washing would slow work and reduce profits. The bloodiest surgical coat is a mark of status. Dr. Pemberton's coat, stiff with 3 years of accumulated blood and pus, announces his expertise. A clean coat suggests inexperience or poverty. Instruments are shared between surgeries because hospitals can't afford individual sets. The same bone saw that amputates a gangrenous leg will be used to remove a tumour in the afternoon, with only a cloth wipe between patients. Operating theatres are designed for speed and spectacle, not healing. Medical students crowd around the table to observe, breathing on open wounds and sometimes reaching in to examine organs mid-surgery. Patient preparation consists of strapping them down and providing leather to bite during cutting. No anaesthesia. Ether exists but is considered dangerous and expensive. Surgeons take pride in speed because conscious patients can only endure so much pain. Post-operative care means checking once daily to see if patients are still alive. Bandages are changed weekly unless they fall off. Wounds are expected to produce laudable pus, white or yellow discharge indicating proper healing. Green or black discharge means death, but nothing can be done. Medical training consists of apprenticeship and observation. No formal education in anatomy or disease. You learn by copying. If your master believes mercury cures infection, you learn to prescribe mercury. Knowledge passes unchanged from generation to generation. Dr. Semmelweis's methods work, but they require fundamental changes to hospital economics. Proper sterilization triples procedure time. Multiple instrument sets increase costs significantly. Hand-washing stations require plumbing improvements most hospitals can't afford. Most disturbing, Dr. Semmelweis's success makes other surgeons look incompetent. If his methods work, then traditional methods kill people unnecessarily. Every surgeon who refuses sterilization becomes complicit in preventable deaths. Economic and social incentives favour maintaining the deadly status quo. Change would be expensive, time-consuming, and professionally embarrassing. You realise that medical tradition isn't based on effectiveness. It's based on what's economically convenient and socially acceptable. The most prestigious surgeons are often the most deadly. Your typical day reveals the horrifying efficiency of systematic murder disguised as medicine. You begin at 5 a.m. preparing Dr. Pemberton's operating theatre. You arrange instruments on their communal tray, the same tray used yesterday for 3 amputations. The bone saw still has dried tissue in its teeth. You wipe it with a cloth, purely cosmetic. Dr. Pemberton arrives wearing his signature coat so stiff with blood it stands up by itself. He's proud of this coat. It represents 15 years of surgical experience. First patient, William Hartley, dock worker, crushed foot, standard procedure. Strap him down, amputate below the ankle. Dr. Pemberton uses the unwashed bone saw, cuts through bone in 90 seconds, cauterizes with red-hot iron. William screams until he passes out. Dr. Pemberton takes pride in his speed. Quick work saves all lives. Pain is temporary, but gangrene is forever. You know William will probably be dead within a week. The odds are roughly 85%. Patient 2, Sarah Mitchell, Baker, infected hand wound. She begs to keep her hand, it's her livelihood. Dr. Pemberton amputates with the same saw used on William, wiped clean on his coat. Sarah's wound was small, probably treatable with cleaning, but Dr. Pemberton doesn't believe in half measures. By noon, Dr. Pemberton had performed 6 procedures using the same instruments, wiped clean on his coat between uses. His hands haven't been washed since morning. 5 of the 6 patients will probably die from infection. Dr. Pemberton considers this normal. Surgery is dangerous. We save who we can, but at 6 p.m. you begin your real work. Dr. Semmelweis's evening procedures follow completely different protocols. You spend 20 minutes preparing, washing walls with chlorine, arranging clean instruments, setting up hand-washing stations. Tonight's patient is Michael O'Brien, a factory worker with an infected leg wound. Dr. Pemberton would amputate immediately. Dr. Semmelweis examines carefully, decides the leg can be saved. You wash your hands for 3 minutes with soap, then soak in chlorine until they burn. Dr. Semmelweis carefully removes infected tissue with sterile instruments, irrigates with chlorine solution, and bandages with boiled cotton. The procedure takes 40 minutes, 4 times longer than Dr. Pemberton would spend. Michael O'Brien will probably keep his leg and survive. Probability roughly 85%, exact inverse of Dr. Pemberton's patients. Working both systems simultaneously reveals precise mechanisms of medical murder. Dr. Pemberton's methods don't just fail to prevent infection, they actively spread it. Every unwashed instrument carries corruption from patient to patient. You're keeping secret records. Dr. Pemberton's methods, October 1847, 23 procedures performed, 21 patients died, 91% mortality. Average time to death, 4.3 days. Dr. Semmelweis's methods, October 1847, 12 procedures performed, 2 patients died, 17% mortality. Average recovery, 18 days. The numbers are undeniable, but you can't share them. You know exactly how to prevent deaths, but social and economic pressures force you to participate in systematic killing. Dr. Pemberton calls a meeting to discuss the Hungarian problem. Dr. Semmelweis's methods, he argues, undermine confidence in traditional medicine. He's suggesting that we've been killing our patients through ignorance, Dr. Pemberton says, that generations of respected physicians have been murderers. Dr. Semmelweis presents his evidence. Mortality rates, recovery times, cost analyses. The data is overwhelming. The response is swift rejection. Statistics can be manipulated, says Dr. Pemberton. His patients are probably healthier to begin with. Foreign methods don't translate to English conditions, adds Dr. Richardson. Hand-washing is women's work, contributes Dr. Whitmore. You watch life-saving evidence dismissed through professional pride and economic self-interest. The physicians aren't evaluating evidence scientifically, they are protecting reputations and incomes. Dr. Semmelweis is asked to leave Guy's hospital. His methods are deemed disruptive to hospital morale. On his last day, he finds you in the supply room. "Continue the work," he says quietly. "Keep records. Someday medicine will be ready for truth." After Dr. Semmelweis leaves, you're alone with your knowledge. You develop compromise methods, sterilizing instruments secretly, washing hands obsessively, recommending amputation less frequently. Your modifications save some patients, but most still die. You're reducing murder rates from 90% to perhaps 70%, but you're still participating in systematic killing. Dr. Semmelweis returns to Vienna, but his crusade destroys his career. You receive letters describing his desperate attempts to convince the medical establishment. He publishes statistics proving hand-washing reduces mortality by 80%. The response is professional ostracism. He starts publicly calling other physicians murderers. He's not wrong, but professional courtesy demands diplomatic language. His hospital contract isn't renewed. No institution wants someone who criticizes medical orthodoxy. His letters become increasingly desperate and paranoid. "They prefer to murder patients rather than admit they've been wrong," he writes. "Every day I don't practice my methods, people die unnecessarily." By 1865, you received his final letter. His handwriting is barely legible, thoughts fragmented. He describes being ostracized by the entire medical profession, unable to practice anywhere. "I have discovered the secret of preventing death," he writes, "but the world prefers death to admitting error. I cannot live with this knowledge anymore." Dr. Ignaz Semmelweis died in a mental asylum, age 47, from an infection in his hand, the same type his methods could have prevented. The irony is perfect and horrible. The man who discovered how to prevent infectious disease died from infectious disease because he was too broken to care for himself. 40 years later, Louis Pasteur proves that microscopic organisms cause disease. Suddenly, Dr. Semmelweis's methods are vindicated. The medical establishment performs extraordinary historical revision. Dr. Semmelweis is transformed from discredited madman to visionary pioneer. The same physicians who mocked his obsession with cleanliness now claim they always suspected he was right. Medical textbooks describe him as the father of antiseptic surgery and a tragic hero ahead of his time. His statistics are republished as groundbreaking research, but the textbooks don't mention the physicians who rejected his evidence, the hospitals that expelled him, or the medical societies that refused to publish his papers. The narrative focuses on brilliance and tragedy, not systematic resistance. Most importantly, the textbooks don't calculate how many people died unnecessarily between 1847 and 1890, because the establishment refused proven methods. Conservative estimates suggest over 100,000 preventable deaths in Europe alone. You've survived to see this revision, now an elderly physician with 40 years of experience. When medical students ask about Dr. Semmelweis, you tell them the sanitized version, brilliant Hungarian physician, ahead of his time, eventually vindicated by scientific progress. You don't mention the economic incentives that prevented adoption, the professional pride that rejected evidence, or the moral cowardice that allowed preventable deaths for decades. The legend serves everyone's interests. Dr. Semmelweis becomes a martyred hero, rather than a victim of institutional murder. The medical profession appears progressive rather than resistant to change. Individual physicians are absolved of responsibility, but institutional resistance remains unchanged. Medical innovations still face skepticism and professional conservatism. Physicians still prioritize reputation over patient outcomes. The structure that killed de Semmelweis continues operating. When you review your career statistics, the mathematics are brutal. Over 40 years, you performed approximately 2,000 procedures. Traditional methods would have killed roughly 1,800 patients. Dr. Semmelweis methods would have killed roughly 300. Your secret modifications probably saved around 400 lives, but you still killed approximately 1,000 people who could have been saved if you'd had courage to challenge orthodoxy. Your caution and professionalism were forms of murder, and yet breaking the system would have ended your career without changing institutional practice. Dr. Semmelweis proved that individual heroism is powerless against systematic resistance. The legend teaches students to admire visionary thinking. The reality reveals how institutions destroy inconvenient truth-tellers. Medical history focuses on individual heroes rather than institutional resistance because the hero narrative protects current institutions by suggesting progress is inevitable and opposition is always overcome. But Dr. Semmelweis wasn't a hero. He was a competent physician who followed evidence to logical conclusions. His tragedy wasn't being ahead of his time, it was that his time preferred comfortable lies to inconvenient truths. The real lesson isn't about scientific progress. It's about how institutions prioritize survival over human lives, and how individuals become complicit in systematic murder through professional conformity. Every time you wash your hands before surgery, you're not honoring Dr. Semmelweis's memory. You're participating in a system that killed him for discovering knowledge that threatened its foundations. The water runs clean, but the blood never washes off completely. If this glimpse into medicine's hidden history disturbed you as much as it should, there are more stories waiting. Stories about how progress became regression, how heroes became villains, and how the myths we believe today were carefully constructed to hide uncomfortable truths. Subscribe to Snooze History for more journeys through the past that popular culture doesn't want you to discover. Each video reveals another layer of suppressed knowledge that will make you question everything you thought you knew about human civilization. And if this video helped you fall asleep while becoming disturbingly more informed, leave a comment about which dark historical truth you'd like us to uncover next. Sweet dreams.